Hi everyone there. I hope you can all hear me and see me. Just send me a smoke signal if not. Yeah. Give me just a thumbs up. Funeka, can you hear me okay?
Yes, I can hear you, sir.
Okay, perfect. Yeah. Okay, well, my clock says 2 minutes past 1, so I think we should get going. Welcome, everybody. Happy New Year, if I haven't said it already. And welcome to our first webinar for the new year. So this is Cochrane South Africa's Systematic Review webinar series. The series is run by our training working group, where we really focus on training and support in evidence-based healthcare methods for researchers and postgrad students. So this is our first webinar for the year. Today I have the great pleasure of welcoming Drs. Funeka Bango and Trudy Leong. So both Dr. Bango and Dr. Leong are senior scientists at the Health Systems Research Unit at the South African Medical Research Council. Dr. Bango is a medical doctor and a health economist with over 20 years of experience across clinical care, managed care, and applied health economics. Dr. Leong is a qualified pharmacist and clinical epidemiologist, and with holding a Bachelor of Pharmacy, an MSc in Pharmacotherapy, and an MSc in Clinical Epidemiology, and currently doing a PhD in Public Health at Stellenbosch University. So today, these two colleagues of ours are going to be talking to us about strengthening transparency and trust in health economic evidence, with a particular focus on these two tools, checklists that can assist us with this, CHEERS and, I'm not sure if I'm pronouncing it, CiCERO. Is that I hope I'm pronouncing it correctly. And they will be able to tell us more about it. So yeah, just before I hand over to Trudy and Funeka, just a few housekeeping. So if everyone could keep yourselves on mute during the presentation, please feel free also to type questions or comments in the chat. We will take questions and have discussion at the end, but please do put them in as they come up for you. And then just finally, to just be aware that we are recording the session, and the recording will be available on Cochrane South Africa's website afterwards. So I think without further ado, Funeka and Trudy, can I hand over to you guys? See you.
Thank you, Sarah. So good afternoon, everyone. I'm going to kick us off just by welcoming everyone, and thank you for joining us today for this discussion on CHEERS and CiCERO, Sarah. So we are assuming that a lot of us that are in the webinar already have a baseline understanding of economic evaluation or using economic evidence. We're assuming that it's people who are in sort of decision-facing positions or working with HTA, so we won't go into detail about the sort of fundamentals and the baseline. We are focusing on the checklists and looking at how we strengthen transparency and trust in economic evidence. Next slide, Trudy, please. So Sarah has already introduced us, so I won't go into too much detail about who we are, but we're from the Health Systems Research Unit, and we also teach at the Stellenbosch University in the Division of Health Systems and Public Health. So today, what we're going to do is to sort of look at the two checklists. And we all know that economic evidence is central to HTA decisions. But if you see, there's a lot of evaluations that have come up in the recent years in terms of primary evaluations, and that has resulted in there being a lot of reviews that have been done for economic evidence or reviews of economic evidence. And these checklists were developed to look at slightly different problems, solve different problems or different challenges in the economic evidence pathway. And something that we want to sort of bring out today is that clear reporting, which we'll discuss through CHEERS, does not really guarantee trustworthy synthesis. And then that's where the CICERO checklist comes in, and that HTA decisions will require both clarity and credibility. So whatever economic evidence, when we use economic evidence, we need both clarity and credibility. And so it's not just about the individual studies, it's about making them trustworthy when you combine the evidence. And so I think with just that introduction of why CHEERS and CiCERO and why now, that's as a country, we're talking about HTA a lot and using sort of evidence-informed decision making. And that's why we chose this topic for today. So I will give over to Trudy to take us through the evidence or the economic evidence pathway, and then she will cover the CHEERS checklist. Thanks, Trudy.
Thanks, Funeka. So before I actually present first on the economic evidence pathway, I just want to remind all that our colleagues at Cochrane South Africa had circulated the publications that describe the different tools in detail, i.e. the CHEERS checklist and the CiCERO checklist. So I'm trusting that everybody has had a chance to peruse that. It'll just make the presentation and what is discussed more informative. Thanks. So as I mentioned, I'm going to first present on the economic evidence pathway. So economic evidence is essentially only useful for decision-making in health technology assessment when it helps decision makers make feasible local trade-offs under local current real-world budget and delivery constraints. So when one is appraising economic evidence, one therefore asks questions like, is the economic analysis relevant to the actual comparators that is being reviewed in policy as well as in practice, because it's normally comparing one against the other? Is it methodologically credible with transparent assumptions? Most importantly, is it transferable to the South African epidemiology and service delivery platforms? One of the areas that in the public sector that one should consider for UHC is perhaps the limited PHC staffing in the public sector, which will impact the final decision too. And furthermore, even when value is demonstrated, i.e. the technology has been shown to be cost-effective, HTA must also assess population affordability, and that will obviously be under Treasury and in public sector or other budget ceilings in private sector, etc. An example here is possibly the scaling up of oral prep nationally in the public sector. So just to verify, value is typically quantified through incremental cost effectiveness ratios, or ICES, as cost per daily or cost per quali. Okay, and then lastly, where the benefits can be delivered equitably nationally across province and priority populations, such as the underserved or marginalized rural populations. So economic evidence aims to support, most importantly, implementable, sustainable decisions, and not just produce a cost effectiveness ratio, an ICER, showing that it's cost effective. Very important, it's important to note that a strong economic analysis or results do not automatically lead to the adoption of the technology in question. The HTA decisions essentially move through a sort of sequential checkpoints. Firstly, obviously, value or cost effectiveness is necessary, but that is often not enough. Then, because you need budget impact, it's necessary, and it's often the limitation under your, as I mentioned previously, your fiscal budget ceilings. Feasibility matters, as I mentioned, touched on in the previous slide, because your benefits depend on delivery capacity across the health system. Procurement dynamics also shape the real price paid and not just the model priced in the economic evaluation. And finally, sustainability requires monitoring and reassessment as the program matures, because things may change in the real world. Prices may increase. Your contextual environment to deliver the technology might also change over time. So in sum, economic evaluation in HTA is therefore a system pathway. It's not a single metric, and we want to determine whether evidence supports real-world prioritization across value, cost effectiveness, as well as affordability, implementability, and long-term impact within our constrained health systems, especially in South Africa and LMICs, touching on high-income countries now, if we look at the USA picture and UK picture. Thanks. So next I'll present on the CHEERS checklist. So this slide introduces the CHEERS 2022 tool. Important, it's the starting point for determining the quality of economic evidence. And I need to stress, it's the starting point. Most importantly, CHEERS applies specifically to primary economic evaluations. That is the studies that model costs, outcomes, and value for decision-making, i.e. your cost effectiveness analysis, cost utility, and cost benefit analysis. And CHEERS was developed because even technically strong analysis can be very difficult to interpret or use in HTA, especially when the reporting is incomplete and not all the information is available. So by strengthening transparency and consistency, CHEERS can ensure that evaluations are clearly described. In other words, as per the slide, evaluations are, first of all, identifiable by describing what decision is being analyzed, interpretable, or in other words, how was the analysis done, and decision relevant, where evidence is usable for downstream appraisal and policy decisions, or if you can say it's a decision usable evaluation or analysis. So how is it used in HTA review practice? If you had read the article, the CHEERS tool includes 28 items, but in HTA review practice, a subset essentially determines whether an economic evaluation is, as I mentioned previously, decision usable. So using the structured criteria, decision criteria, which I previously described 4 slides back, and is now listed in this first column of the table on the slide here. HTA reviewers generally assess whether comparators are aligned with policy and practice, that is, if the evaluations are decision relevant. Methods are transparent, and uncertainty has been robustly explored. Remember, we're dealing a lot with modeling. So next, research findings are transferable to the local context, our South African context, and this includes explicit reporting of the setting, perspective, unit costs of the evaluation, and also clear reporting of resource use and budget implications is essential, since, as mentioned previously, health budget ceilings often limit the scale up of the technology in the country or across specific populations nationally. And then finally, equity and feasibility require reporting of subgroup and delivery context to ensure benefits can be delivered across our diverse population in light of universal health coverage. So essentially, CHEERS does not replace appraisal, but it ensures primary economic evaluations are reported clearly enough to serve as usable evidence for decision making. I want to mention transferability, which is especially important in South Africa and other LMI settings, as I'm sure many are aware, is that many economic evaluations are developed in high-income contexts where there's different costs, comparators, and health system capacity, which might not be applicable locally. So the key question we want to look at is not only whether an intervention is cost-effective, but whether the results of the economic evaluation actually apply locally to our setting. By assessing transferability, we require clear reporting of the setting, comparators, costing approach, very important, delivery assumptions, and subgroup impacts. So CHEERS enables transferability assessment by making the contextual details explicit to ensure that it's adequately and transparently reported. But it does not ensure applicability, as Funeka mentioned initially, where you require additional judgment about local validity, feasibility, and system constraints. So CHEERS provides the transparency needed to assess local usability. As I mentioned earlier, it is a starting point for doing appraisal. Thank you. Funeka, over to you.
Thanks, Trudy. I'm going to just present so I can move the slides. So just bear with me, colleagues. Is something happening on your side? Sorry, it's taking a bit long.
Yes.
Okay. Sorry, I'm just going to jump to where Trudy left off. Okay, so you don't see, is it on presenter mode on your side, Sarah?
Yes.
Okay.
Sorry.
Great, thank you. So we go back to this idea that I introduced of transparency versus trustworthiness, and that we need to make the distinction and understand why they are both important and why these tools that we are presenting today have complementary roles. So transparency is not trustworthiness. So we talk a lot when we refer to the CHEERS checklist. Even if you read the paper, the article that we shared, it does mention that it's a reporting checklist. So, and it focuses a lot more on transparency of the method. So transparency of the reporting of primary economic evaluation studies. And if you then look at synthesis, that transparency doesn't necessarily translate if the actual synthesis is weak methodologically. And so the risk is that sometimes one can mistake well-reported primary studies for reliable decision evidence if you then synthesize those studies. And that can result in false confidence, and we then treat conclusions from a weak synthesis as decision ready. And so we need to look further into the trustworthiness and how the analysis was conducted to be able to trust that we can use those results or that evidence in decision making, as Trudy has said. So I'm going to now move to the CiCERO checklist, and just to sort of look side by side, compare. These are two tools. They're different, but they do complementary jobs. So CHEERS focuses on reporting quality, while the CiCERO checklist focuses on the conduct and risk of bias. And in economic evaluation, our understanding of risk of bias is sort of broader. It's methodological, it's contextual, it's linked to sponsorship, or modeling choices or publication bias. It's about the assumptions that we make when we conduct an economic evaluation, the thresholds, its transferability, again, as Trudy has mentioned, and its interpretation. So that is covered by sort of assessing using the CICERO checklist. And so CICERO focuses on reviews, systematic reviews instead of primary studies. And we use it to understand or assess the confidence or trustworthiness of the results that come out of that synthesis. Yeah. So the problem that the authors of the CICERO checklist, which is a ISPO guideline, was that there were trust gaps in systematic reviews of economic evaluations. So reviews with cost and cost effectiveness outcomes are methodologically heterogeneous, and existing tools like the PRISMA checklist, the AMSTA tool, the ROBIS tool, do not adequately address economic methods. And this is not to discount these tools. The checklist, this particular checklist, was created building on these other tools, and it was a consensus method with these people who created the other tools. So we're not discounting them, but it is a fact that the reason why this particular checklist was developed was because the other checklists don't adequately address economic methods. So as we said, reporting standards alone do not protect against bias synthesis or inappropriate interpretation, particularly important for us when we think about decision making. So reporting quality does not equal to trustworthiness. So the CICERO checklist is a framework for trust. It's a ISPO criteria for cost effectiveness review outcomes. It's not a score. It doesn't generate a single quality number, and that's the main thing that the authors of the paper actually want us to understand, that it's a appraisal tool for the quality or the conduct and the risk of bias of systematic reviews of economic evaluations, or systematic reviews that include cost and cost effectiveness outcomes. But it doesn't give you a score, and it's not just reporting, as we've said, it assesses conduct. And the output is then a structured judgment about the confidence in the results. It's got 13 signaling questions, and I just have to make a distinction on what it does and what it doesn't do. So it appraises how the review was conducted, flags risks that threaten trustworthiness, and helps determine whether evidence is decision ready. It does not replace PRISMA or CHEERS. It does not rank reviews. It does not judge cost effectiveness or make decisions. But it's important to understand whether the review, there was any bias, and how the actual review was conducted. And in this community, many of us know and understand the steps of conducting a review, and this also follows those steps. And it's important to look at the different steps and how they actually were conducted. And it's important also to understand that the sort of planning and search steps, the steps 1 and 2, are also important to look at, because if there's weakness in those early stages, no matter how great the down the line is, it will collapse the trust in the other stages of the review. So if we think about the stages 1 to 4, we will not go through all the questions in the checklists. We don't have time to go through all of them. So we are presenting the most important practical things that we can bring out of the CICERO checklist. So this is where, as I've said, the bias can enter the pipeline if you're assessing a review, or even if you are conducting a review. So you must, we need to make sure that the search integrity, that the search must be reproducible. As with any other systematic review, it doesn't only apply to reviews that have costs and cost effectiveness outcomes, but it's also important for us. And one other thing to consider is that for HTA, sources need to include grey literature, because as we all know, a lot of the evidence that is relevant for HTA does not necessarily, live in PubMed. And so it's important to search the grey literature. And if for HTA purposes, grey literature is not searched, there needs to be justification for why that is the case. And if you look at selection and appraisal, we, like any other systematic review, make emphasis on duplicate screening to avoid selection bias, and also importantly on appraising the included studies. So using checklists and tools like the CHEERS checklist, like Trudy has just presented. And obviously there's other checklists that you can use. Phillips' other checklists, but it's important that the included studies have been appraised for quality. And we then know that if these, like any other systematic review, doesn't have to be of economic evidence, if these are missing, it's likely, and the narrative review is not a systematic review, and then that will introduce bias, and it might have been a cherry picking of papers and not necessarily a systematic review. So this is where I will spend a bit more time, because this is the danger zone for reviews of economic evidence. A lot of the other areas that I've presented before for the other stages 1 to 4 are common in other reviews, but this is important for us for systematic reviews that include costs and cost effectiveness outcomes, because this is particularly the methods section that makes systematic reviews of, cost and cost effectiveness studies different. And so I will spend more time looking at these different issues. And so it's important, there's nuances come out of the sort of the checklist, that it's important to make sure that one standardizes all the costs to a common currency and price year before the synthesis. Because if one has different currencies and price years, then that means the cost estimates are not directly comparable. And then, which means you can't pull the costs or the ISAs. And if you actually do pull the cost or ISAs, it's arithmetic. It's not necessarily reality, because actually methodologically, you can't do that if you don't have standardized currency year or before you synthesize. The other thing is the mixing of empirical versus modeling studies. These are very different, and they shouldn't be combined. And models include more assumptions, while trials measure observed effects. And so there needs to be separate synthesis for trials and models. And also, if you look at the way economic evaluation studies are conducted, there's a lot of heterogeneity. Trudy has mentioned some of this as, settings, methods, populations. So studies usually answer slightly different questions in different contexts. And if one just pulls the data together, you can mask contextual variation, which in decision-making, particularly for HTA, you want those contextual factors, because obviously you're looking at a defined population for a specific context. And so what we then tend to do in this kind of reviews is that we use narrative synthesis, structured narrative synthesis. So sometimes, which this is why it's important to actually have a tool that looks at these sort of syntheses to understand the trustworthiness is that sometimes people pool the results despite the incompatibility. So then they force the quantitative synthesis, and it presents or produces a false precision and makes the person reading the results overconfident, because the paper will then, will overstate what the results are actually presenting. So the restriction needs to be, or pooling needs to be restricted to homogeneous comparable studies only. And this is what this figure is showing in the task force. They present this and they stress this a lot. And there's a comment that most systematic reviews of economic evidence or economic evaluations should stop at the narrative synthesis stage, and pooling is only valid when strict comparability conditions are met. And you'll see we sometimes do interchange between so systematic reviews of economic evaluation. Sometimes we say that, and sometimes we say systematic reviews including cost and cost effectiveness outcomes. It essentially means the same thing. So, and the next stage, which is stage 6, this is important because if you're looking at a review, or if you're reading a review, or if you're even conducting a review that includes cost and cost effectiveness outcomes, this stage, the presentation and reporting, determines how results are interpreted. It determines how decision-making bodies interpret the results. And so it's important to also look and make sure that things are done correctly and there's trustworthiness in the stage. And some of the important things that we want to bring out, that if they are done wrong, the review then loses trustworthiness. And these include things like if the limitations are omitted, if you pool the evidence or studies that are not comparable or not compatible, then sometimes people present conclusions that are stronger than the evidence supports. Sometimes authors, ignore uncertainty, and that can be a big problem because then you're not presenting the reality. And also, we always avoid making broad claims because a lot of these studies have slightly different. So even though the methods, economic evaluation methods, are rigorous, or there's, these studies, try and be rigorous, they come from different contexts. And so economic evidence or economic evaluation studies are highly contextual. And so you need to understand, before you can pull results, or even in your synthesis, you need to understand the context from which that study was conducted to be able to interpret it appropriately, and then avoid making broad claims. And if those broad claims are made, usually then people make policy recommendations without the necessary caveats, which would then have been informed by the context from which the primary studies were conducted. Are there any questions? Before we will do a small exercise, but we can take questions now before we go into the exercise.
I don't know if you can see this, the chat, Funeka.
Okay, let me open the chat.
Thanks, Funeka.
Sorry, guys.
I hope you can all hear me now.
We can hear you, Sarah.
Yeah, thanks. We do have a question from Chichoki. Sorry, I hope I'm pronouncing your name correctly. She's asking which among CHEERS and the second panel on cost effectiveness in health and medicine reporting checklists should authors give preference to? I noticed that both are not identical, or am I getting it wrong?
Do you want to take it, Trudy, or do you want me to take it?
You're more than welcome to take it, but I just want to emphasize again that the CHEERS checklist evaluates the reporting quality. So in other words, has the economic evaluation been adequately reported, especially if it's been submitted for journal publications. So it's got to have the type of models that have been used, the perspective of the economic evaluation, the type of costs, all the other model inputs, the epidemiology, the uncertainty, and etc. Well, I think it's the understanding of the CiCERO checklist is used to determine the quality of not a single economic evaluation, but where you do a systematic review of economic evaluations, what they started to do now. In other words, you take all the economic evaluations and you synthesize it to produce a systematic review, just the same like you do with the clinical evidence. This is a systematic review of economic evaluations. So they're two different checklists. So, Funeka, if you want to extrapolate on that, you're more than welcome to. Thanks.
Thanks, Trudy. So Trudy has answered the question. I just want to add, there's a lot of other checklists in the health economics field. There's a review that was done actually that has shown that there are approximately 20 different checklists, but CHEERS is the one that's used the most. So you will see there's a Drummond checklist, there's Phillips, there's checklists that, so there's quality and there's reporting. CHEERS is reporting, so it looks at the reporting of the study. It doesn't necessarily look at the quality of how the study was conducted, which is it's a slight nuance, but it's a reporting checklist. You will see in a lot of reviews, people still use CHEERS as a proxy for quality, but in essence, it is a reporting checklist. It's not a quality, and you will see for the problem is that the other checklists are a bit old, including Drummond. And so people tend not to use them because they're older, but there are other checklists that are specifically for methods. And also, so Drummond's like specifically looks at the actual methods of conducting, so quality of the actual study, not reporting. And sort of the Phillips checklist looks at models and sort of the conduct of the modeling study. So you'll see a number of checklists, but CHEERS is the one that people mostly use because it's the most up-to-date, quote unquote. The last one is 2022. And then, so people use it, you'll see that it's used as a proxy for quality, but it's a reporting checklist. I hope that answers your question.
I'm just, oh.
Okay.
Thanks,
Anybody
Funeka.
else?
I hope
Sorry.
that answers. I hope that
Chijoke,
answers.
is that your, yeah.
Yes. Hi. Thank you so much, Funeka. And sorry, I didn't catch the name of the lady that
Trudy.
That answered it first. Thank you very much. I'm actually a bit quite new in CEA. Of course, I did it a bit in graduate study, but I wanted to start doing research in this area. So yeah, I think you answered it a bit. It's just that unfortunately, I'm not actually with the textbook here. That's second panel, textbook basically. Where they actually did mention the CICERO, the CHEERS 2013, the first checklist that has been revised now with this 2022 version. They actually did mention, because that book was published, I think, in 2017, if I'm not mistaken. So their checklist is actually a bit more comprehensive than this. It has definitely more than 28 items. And then, for instance, one thing that sticks out to me is where they say that every economic evaluation, irrespective of the orientation, must include a societal perspective. So basically, their checklist includes the due, in addition to whether you're using the health sector perspective, cost perspective, whether you also included a societal perspective. So it's just like seems even to be more than 30 items. So I just wanted to know if, given that I'm somebody who wants to dabble into this in terms of research, whether if I use this checklist, which seems to contain fewer and actually more manageable items, if I use this checklist in terms of reporting, because that is also a reporting, not necessarily a method checklist from my understanding, if I use this, whether reviewers will penalize me, that was just my confusion with the two. Thank you.
So that checklist also was a I mean, even shares a consensus, but that checklist leans more towards quality, so conduct methods, while CHEERS is basically reporting. So CHEERS, reviewers tend to favor CHEERS because it's the latest, but you'll have to, the main thing, whatever checklist you use, when you're kind of doing sort of looking at included studies, whatever checklist you use, you have to justify why you use that checklist. I do know, though, through my experience with trying to publish reviews, is that they want you to, there's always a comment that CHEERS is the latest checklist. And so they want you to use it in the review. But if you justify, you'll have to see what the reviewers will say. But CHEERS, that other checklist is more quality, not necessarily reporting, while CHEERS is reporting. But with that said, people do use it as a proxy. And so you have to decide, a lot of people use still reviews now, which actually are published using the Drummond checklist, which is also very heavy methods, and they will justify why they use Drummond, and some of those, will still be published now, even though the Drummond checklist is a 2010 checklist.
Thank you very much. I think that is quite helpful. Thank you.
Okay. Anyone else?
So I see we've got another question. Malawi, I hope you can hear me, Trudy and Funeka. So the question is, in light of strong contextual dependence of ICER interpretation for policy decision-making, is there a defensible willingness to pay threshold for South Africa as a limit, or should ICERs be interpreted primarily through complementary decision criteria, such as budget impact analysis?
So we don't have it. I mean, we have a threshold that we're using, the what's the author's I just forgot now. It's geometry. Yeah. So we're using, so people have been using that threshold for, but in research. And so this is sort of the slight distinction. People have been using that willingness to pay in research, but as a country, we don't have a willingness to pay threshold. And it's something that we should be sort of looking toward setting up if we're going to have to make evidence-informed decision-making and, interpreting in ISA, because we're going that direction. But now people are still using, different, I see even a lot of published, even though we know when people are trying to stay away from the WHO LMIC thresholds of GDP, people are still using them in research and presenting their ISAs according to that, or judging it with that sort of willingness to pay. But I think it depends on who's interpreting the evidence and what people do now, actually, because for decision making, you have to, for contextual and structural issues or considerations, you have to have a budget impact analysis in addition. So that then helps you determine whether or not the policy decision is relevant or we should go ahead or not. So
Sorry.
it's the next thing to do, I think, as a country. I mean, I don't know if you which country you're referring to when you think policy or decision making, but South Africa definitely, we need to have a threshold, a country relevant threshold, or that we can assess, our ISAs based on. Other countries have. I think there's Ethiopia. Not sure, but South Africa doesn't have, and we have a I think Ethiopia and Ghana might have, but we have a research-based one that we use a lot in research. Is that Ijeoma and her co-author wrote about. We use it for both DALIs and QALIs, even though it was a DALI-based threshold.
Can I comment as well, Funeka?
Yeah.
Sorry, I didn't want to involve. So, just regarding the WHO 3 GDP threshold, obviously there's a lot of controversy around there because the evidence behind that is not very strong, if at all. So people are tending to move away from the 3 GDP threshold. And there is, interestingly, other papers for LMIC countries that have been published, which we're more than willing to share, and that is obviously done internationally. As Funeka mentioned, there isn't a threshold that is being used for public sector decision making. The thresholds are being used for research specifically. I think what is more important is that regarding our budget constraints and fiscal constraints, the budget impact or affordability is of importance to South African public sector decision making, purely because our funds are really, really limited. But as we mentioned earlier, you can't exactly do a budget impact if that particular technology is not cost effective. So, as Funeka mentioned, it goes hand in hand. Whether they're going to determine or create a threshold for South Africa is another story. I do know they have one for HIV, just out of interest, which they are utilizing for the ARV regimens. So yes, be very interesting to see the space. There is a HTA map that is being in the process of being formulated. Thanks. Over.
Thanks, Trudy. Okay, we'll just need to do the example because we've got 10 minutes left. So just if you can write in the chat, we just have a sort of interesting hypothetical example. If you have this kind of evidence and the primary, study that was done in 2022, when you did the CHEERS checklist, you found that the perspective was unclear, the time horizon was a lifetime but not justified, the comparator was standard of care but not defined, and the price here was not reported, and they only did a one-way sensitivity analysis. And that study was part of so when you looked at the sort of use the CiCERO checklist for review, that particular study, 2022, was part of this review that included 12 studies from 6 countries. Their search strategy was not fully reported. The screening, whether or not it was duplicate, was not clear, and they didn't have any sort of transferability or contextual discussion, and they didn't, appraise the study limitations. Do you think this is decision ready? Sort of can choose A, B, C. If you think it's decision ready, You can choose A, write in the chat. If you think it's not usable, you can choose C. If you think it's uncertain, you can, just decide B. So I'll give you 30 seconds to put your choices in the chat, and we'll take it from there. C seems to be winning. Does anyone want to say, who says C? Why do you say C?
I mean, it explains itself. Hi, Funeka and Elisa here. Thanks for your presentation to you and Trudy. I'm just looking at the key information column. It says, they're not sure about the perspective of the study and the time of justification about that. There's no comparator. The price here is not reported, and there's uncertainty over sensitivity analysis. Is that, did I read that right? Yeah. And the search strategy not fully reported, 12 studies, 6 countries. There's not a lot of studies to make a decision out of this. What else? There's no structured appraisal of study limitations. That's a huge red flag. Yeah, that's just my
So
opinion.
what would you suggest? If you say it's not usable, then what's the next step?
The next step is to go back, right? Assess the evidence, access, more evidence, appraise the evidence, and do things right, like from that step, from the first step where they said the perspective or maybe the objectives are not clear. Yeah.
Yeah, thanks, Annalisa. I agree also that you'd have to go back and redo the review, and maybe, in your analysis or synthesis, choose studies that, have presented evidence that is transparent, you know what I mean?
Yeah.
And so I agree with everyone that says it's not usable. So it would have to go, if you're a decision-making body, you'd have to request, for a review, another review to be started from scratch.
Yeah.
Yeah. So just a cheat sheet. So CHEERS, the deal breakers are, if because we're looking at interpretability, if the perspective is unclear, the comparator is undefined, or there's no price years. And if you're looking at the CICERO checklist, whose goal is trustworthiness, if the set is not transparent, no duplicate screening, no structure appraisal of included studies, and if there's inappropriate pulling of the studies that are heterogeneous in what they present. So high quality decisions require clarity and credibility. CHEERS prevents false clarity. CICERO prevents false confidence. So we don't just look at the ISA, we look at what methods that informed what the results that are presented and how do they interpret those results. And so before we go, I do want to say that I teach at, as I said, at the Division of Health Systems and Public Health at Stellenbosch University. We have the full short course for systematic reviews of economic evaluations. And so it's still open. The deadline to apply is the sorry, I just have to remind myself, the 25th of February, and all the information on who to contact is there. And so we have, if you're interested, as Chijoke was saying that he's interested in this kind of work, we teach a lot in that sort of health economics department with economic evaluation, and also Trudy teaches in the priority setting course, which is also part of that. And so if you are interested, we would like to invite you to look at, that particular course if you're interested in systematic reviews of economic evaluations particularly. So we've got a few minutes to go, but otherwise that is all we have to say. And those are our email addresses. I don't know, Trudy, if you want to say something, and then we hand over to Sarah to conclude.
Nothing from me. Thanks, Funeka, and thank you, Cochrane South Africa, for the opportunity.
Thanks so much, Trudy and Funeka. Really, I learned such a lot. Absolutely fascinating to learn more about these checklists, and hopefully people start using them and using them in better ways. So I think we've got 3 minutes. We probably have time for one last question. If there are any final comments or questions. I also see Trudy and Funeka, there's requests if you could make the slides available and also share the course brochure. So if you could share that with us, we can then distribute and also put on our website here.
Thank you, Sarah. We'll do that.
Okay, well, thanks everyone.
Thank you so much.
Thanks for
Lovely
listening.
To see a great turnout for our first of many to come of our webinars as part of the Cochrane South Africa Training Working Group. So we hope to see you all at our next webinar with more details to follow about that soon. Thanks everyone. Take care. Bye.
Thank you, Cochrane. Bye.
Bye. Thank you.